Picture this. You're in labor. The contractions are intense, and someone offers you what seems like a magic button to make it all stop. An epidural sounds perfect, right? But before you make that decision, there are some critical things about epidurals that most doctors won't fully explain until you're already in that hospital room. What I'm about to share might completely change how you think about pain relief during childbirth, and by the end of this, you'll understand why thousands of women are now choosing to say no to epidurals even when the pain gets intense. Let's start with what actually happens when that needle goes into your spine. An epidural involves inserting a catheter into the epidural space around your spinal cord, numbing you from the waist down. Sounds simple enough, but here's what they don't tell you. That needle is about 3.5 inches long, and the procedure itself can be terrifying. You have to sit perfectly still while experiencing contractions, curled forward in an unnatural position, while someone inserts a needle into your spine. Many women report that the epidural placement was more traumatic than the labor itself. And here's the kicker. It doesn't always work. Studies show that epidurals fail to provide adequate pain relief in up to 20% of cases, meaning 1 in 5 women goes through that intimidating procedure for nothing. But let's say your epidural works perfectly. Now comes the cascade of interventions that nobody warned you about. Once you get an epidural, you're essentially confined to bed. You can't walk, you can't move freely, and you can't use gravity to help your baby descend. This immobility alone changes everything about your labor. Your body was designed to move during childbirth. Women instinctively sway, rock, squat, and change positions because movement helps the baby navigate through the pelvis. When you're numb and bedridden, you've just eliminated one of nature's most powerful tools for progressing labor. And here's where it gets really concerning. Epidurals significantly slow down labor. Research consistently shows that women with epidurals have longer labors, sometimes by several hours. Why? Because the medications interfere with your body's natural oxytocin production. Oxytocin is the hormone that drives contractions, and when its natural rhythm is disrupted, your contractions can become less effective. This means you're more likely to need pitocin, a synthetic version of oxytocin, pumped through an IV to artificially strengthen your contractions. But pitocin-induced contractions are often more intense and less natural than your body's own contractions, creating a more difficult experience for both you and your baby. Let's talk about what happens to your ability to push. With an epidural, you lose sensation in your lower body, which means you can't feel when or how to push effectively. Imagine trying to use muscles you can't feel. Many women with epidurals end up pushing for 2, 3, even 4 hours because they simply cannot feel what they're doing. This extended pushing phase doesn't just exhaust you, it increases your risk of needing interventions like forceps or vacuum extraction. These instruments can cause trauma to both mother and baby, including potential nerve damage, bruising, and in rare cases, serious injuries. Now here's the intervention cascade that hospitals don't openly discuss. Epidurals dramatically increase your chance of needing a cesarean section. While hospitals will tell you that epidurals don't cause C-sections, the data tells a different story. Women who receive epidurals are 2 to 3 times more likely to end up with a cesarean delivery. Why? Because all those factors we just discussed, the slowed labor, the inability to move, the less effective pushing, the need for pitocin, all compound together. When labor stalls or the baby shows signs of distress from the prolonged process, suddenly you're being wheeled into surgery for an emergency C-section. That simple epidural just transformed your birth from a natural process into major abdominal surgery with a 6-week recovery time. But wait, there's more. Let's discuss the side effects that happen during and immediately after the epidural. The most common side effect is a sudden drop in blood pressure, which happens to about 14% of women. When your blood pressure drops, your baby's heart rate can drop too, causing panic in the delivery room and often leading to more interventions. You'll also likely need a catheter inserted to empty your bladder, since you can't feel the urge to urinate or walk to the bathroom. Many women develop fever during labor with an epidural, which can lead doctors to suspect infection in the baby, resulting in unnecessary antibiotics and sometimes extended hospital stays for the newborn. Then there are the itching and shaking. Up to 70% of women experience intense itching all over their bodies from the opioids in the epidural. Imagine trying to focus on meeting your new baby while your entire body is crawling with itchiness you can't scratch away. The shaking and trembling can be so violent that some women feel like they're convulsing. These aren't minor inconveniences. They're deeply uncomfortable experiences that can make those first precious hours with your baby miserable. Here's something really important that affects your recovery. Epidurals can cause severe headaches that last for days or even weeks after birth. This happens in about 1% of cases when the needle accidentally punctures the dura, causing spinal fluid to leak. The resulting headache is debilitating, so severe that you can barely lift your head. Now imagine trying to care for a newborn while experiencing the worst headache of your life. Some women need a procedure called a blood patch to fix it, which means another needle in your spine. Let's talk about something even more concerning: the impact on breastfeeding. Multiple studies have found that babies born to mothers who had epidurals have more difficulty latching and breastfeeding in the first few days. The medications from the epidural cross the placenta and can make babies drowsier and less alert. These babies often have trouble coordinating the suck-swallow-breathe pattern necessary for effective breastfeeding. When breastfeeding gets off to a rocky start, many women give up, not realizing that the epidural played a role in creating these difficulties. If successful breastfeeding is important to you, this is a huge consideration. There's also the elephant in the room that nobody wants to discuss: long-term back problems. While some studies claim epidurals don't cause chronic back pain, countless women report persistent back pain at the injection site that lasts months or even years. Some women develop permanent numbness or tingling in their legs. There are documented cases of nerve damage from epidurals that have left women with lasting disabilities. Yes, these are rare, but when you're the one dealing with chronic pain or nerve damage, statistics don't matter much. Now let's consider the emotional and psychological aspects. Many women who have epidurals report feeling disconnected from their birth experience. They describe watching their birth happen to them rather than actively participating in it. Some feel like they missed out on the full experience of bringing their child into the world. There's research suggesting that women who have unmedicated births report higher satisfaction with their birth experience and feel more empowered afterward. The intensity of natural childbirth, while challenging, can be transformative in ways that a numbed, medicalized birth simply isn't. Here's something that might surprise you. The pain of childbirth serves a purpose. Your body releases massive amounts of endorphins during natural labor, your own natural pain relief that's actually stronger than morphine. These endorphins create a natural high that helps you bond with your baby immediately after birth. When you get an epidural, you short-circuit this entire hormonal process. You miss out on that incredible rush of endorphins and the intense feeling of accomplishment that comes from working through labor naturally. Many women describe unmedicated birth as the hardest thing they've ever done, and simultaneously the most empowering experience of their lives. Consider also the impact on your baby. Babies born without epidurals are typically more alert, more responsive, and better able to breastfeed immediately. They haven't been exposed to the medications that cross through the placenta. They've also benefited from the hormonal cocktail released during natural labor, which helps prepare their lungs and systems for life outside the womb. The stress of labor, while it sounds negative, actually triggers important adaptations in the baby that help them transition to breathing air. There are effective alternatives to epidurals that work with your body instead of numbing it. Water birth or laboring in a tub can provide incredible pain relief. Water is often called nature's epidural. Movement and position changes, walking, swaying on a birth ball, or using a squat bar can dramatically reduce pain by working with gravity and helping the baby descend. Continuous support from a trained doula has been shown to reduce the need for pain medication significantly. Techniques like hypnobirthing, breathing exercises, and visualization can help you work with contractions rather than fighting against them. Counterpressure, massage, and hot or cold compresses provide physical relief. Many women find that creating the right environment, dim lighting, their own music, familiar scents, helps them enter a natural, almost meditative state where they can handle the intensity. The truth is, your body was designed to give birth. Women have been doing this for hundreds of thousands of years without epidurals. Your body produces exactly the hormones you need when you need them. Your body knows how to open and allow your baby to be born. The pain of childbirth is productive pain. It's not injury or illness. Each contraction brings you closer to meeting your baby. When you trust your body and have proper support, you might be amazed at what you're capable of enduring. Before you decide on an epidural, ask yourself, are you choosing it because you genuinely want one or because you've been conditioned to fear birth? Has anyone explained all of these risks and side effects, or have you only heard that epidurals are safe and common? Do you understand that choosing an epidural might set off a chain reaction of interventions that could end in surgery? Have you explored all your other options for managing labor pain? Sometimes the most important questions are the ones nobody asks you.